How's it, Hawaiian? Welcome to the latest edition of the Weekly Dose. My name is Brooks Bear, and I work for the Hawaii Department of Health. Over the next 10 minutes or so, we're going to spend some time talking about COVID vaccines, and in particular, COVID vaccines for a specific age group, adolescents aged 12 to 17 years old. They're the latest group to be added as eligible for COVID-19 vaccines. And here to share some of his knowledge is Dr. Julius Pham. He works at the Queens Medical Center, where he is a critical care doctor and also an emergency physician. Dr. Pham, thank you so much for taking time with us.
Thanks for having me, Brooks.
Now, I know that you got yourself vaccinated pretty early on in the game, so you must have real confidence in the vaccines. Why is that?
Oh, certainly. The vaccine has a very good safety profile and a very good efficacy profile. That means it just works. When you compare this vaccine, the Pfizer vaccine, to the flu vaccine that we all are familiar with, that we get on an annual basis, the Pfizer vaccine, 95% effective. Your typical flu vaccine, 40 to 50% effective. So we know it works. We know it is safe. At this point in time, we're talking about hundreds of millions of doses across the country and minimal side effects.
And of course, there are three products on the market, not just Pfizer. You're talking Pfizer because that's the one that the 12 to 15s are eligible to receive. But we've got three products out there.
That's absolutely true. And Pfizer has the most data because it was first to hit the market, and it's got the widest approval age range. So we know a lot about it.
Okay, so your son, Everett, is 12 years old. And when they approved it for the 12 to 17 year olds, I would think that you did some more thinking and maybe did some more homework, because you're a parent who loves his kid and you want to do the right thing. So take me through that process. Did you have additional questions? What did you research, and what conclusions did you come to?
Yeah, as a medical professional, we have access to the primary research data that was used to approve the data, and you approve the vaccine. And so looking at that data, it's a smaller data set compared to the adult research that they did, but they showed 100% effective. So 95 was good, 100% even better. And the complications rate, the side effects were no different than they were in adults. So that gave us a lot of confidence, certainly gave me a lot of confidence that, this is something that I wanted for my son.
Ultimately, what did it come down to? When you kind of weighed the options, what ultimately made you decide that this is the right thing for my child?
Yeah, it was a matter of giving him a protection, right? So I wanted to make sure that he wasn't sick, that he didn't get COVID. As a parent, that's kind of part of my job, to protect him in any way possible. It goes with seatbelts, it goes with healthy nutrition, getting his exercise. And this was just one of those things, I had to look out for him and make sure that he was okay.
So how did it go? You went down there, he got his shot. How was the process? And then afterward, how did it go?
Well, the process went very smooth. We went down there, we got our registration information in, the nurses and the staff were excellent. And I was nervous for him. I was probably more nervous than he was, but he took it like a champ, so they were very kind to him. They gave him the shot. I was concerned that he'd scream out in pain and make a huge scene, but that didn't happen. He was great.
Well, yeah, and he took it like a champ. I remember getting my shot, and I looked at the nurse and said, I came down here to get a shot. Don't fake it. I honestly didn't even feel it. Some people don't feel it. I didn't. Other people do. But I'm glad to know that went well. So your advice for other parents, and that's really why we're doing this, is to provide information to people and to parents. What would your advice be going forward as they consider whether or not the vaccine is right for their child?
Yeah, I think just the thinking for most parents, our primary duty is to protect our kids and to take care of them. So that should play some role and sway you. The other thing is I wanted to get our kids back to normal life And so for parents out there that want to get their kids into sports again, so my son plays tennis, he plays basketball, and he hasn't been able to do that for the last year. And so that was important to him, important to us. Also, he's got a lot of buddies. We used to send him over to have play dates and hang out with his buddies all the time. And we haven't been able to do that either. And so this gets us one step closer. And then same with schools. I think not all the schools are back in session 100%. The higher we can get, or the faster we can get our kids vaccinated, the quicker we can get kids back into school. And as much as he complains about going to school, he has a blast there, and he always talks about all his friends and things. So he enjoys the social interactions at school.
Okay, what would you tell someone who says, well, I don't need to vaccinate my child because children really don't get that sick from COVID?
Yeah, so while it is true, children generally don't get as sick as adults from COVID. They are a source of carriers for the disease. Moreover, some do get sick. So we had our first death in a child here in Hawaii about a month ago, in fact. And so in general terms, that's a true statement, but boy, I don't want to be responsible. I don't want to know in my heart if my son were to get sick and I had the option to do something about it and I didn't. And so to that point, to the second point is that they may not get sick, but then they become this carrier or this reservoir for COVID, and they would spread it around. They could potentially then spread it back to my wife and I, or our friends and some of the elderly people that we may come in contact with. And certainly, I don't want to be responsible for giving COVID to anybody.
All right, especially not when you have such confidence in the vaccines. All right, before we wrap it up tonight, I want to play a little rapid fire, fact or fiction. All right, so fact or fiction, COVID vaccines will change my DNA.
Yeah, so that's definitely fiction. The vaccine does not change your DNA. It would be great if we had gene therapy that can change your DNA to the extent that is available now. The COVID vaccine has a sequence of RNA in it that tells your cells to code for a protein that then your body responds to. So it doesn't change your DNA, but it does have a sequence of mRNA. So that's a specific set of instructions for your cells to create a protein.
Okay, that's fiction. The vaccine does not change your DNA. Here's another one, fact or fiction. The COVID virus is actually in the vaccine. So when you're vaccinated, you're given COVID.
Yeah, definitely fiction. So there are no COVID viruses in the vaccine. Now that's probably a remnant of old vaccines, like our polio vaccine that has what they call dead virus particles or attenuated virus. But the new vaccines these days, they only have the sequence of instructions. So it just has the message to your cells to create a certain protein. No virus particles are in there.
Okay, another fiction. All right. Fact or fiction number 3. Fact or fiction, the virus will impact a woman's fertility, her ability to have children.
Absolute fiction. So I've seen these theories, I've heard these comments before. I have no idea where they come from. I suspect these are campaigns to scare people out of getting vaccines. There's absolutely no evidence or basis for that.
Okay, we're 3 for 3 on the fictions. I'll throw one more out at you, and that is, Doctor, I've already had COVID, so I don't need the vaccine.
Yeah, so that's actually a good one, because when you do get COVID, you do have immunity to some extent to the COVID, but that immunity and that level of protection can vary between individuals depending on how severe your initial infection was. When you get the virus, you get a known amount of immune response, so that standardizes it. Moreover, we know exactly when and how far apart these vaccines need to be given. So it gives us a known quantity of immune response. So the advantage of the vaccine is it's very well studied, and we know what it can and cannot do, whereas with individual infections of COVID, there can be a lot of variation.
All right. A lot of fiction, unfortunately, circulating, but Hawaii has already passed the 50% mark as far as people in the entire population of Hawaii being fully vaccinated. In other words, having received 2 shots. So Hawaii is well on its way. And Dr. Pham, without question, it is because of heroes like you in healthcare. There are thousands of healthcare heroes around the state. And those of us who are not healthcare professionals cannot thank you enough for the work you have done to get us to the point where so many people are vaccinated, so many people have good information, and thanks to these people who have decided to look at the science and get vaccinated, we can now go outside without our masks. And so we've really turned a corner. We still have a ways to go, but we're going to get there.
Absolutely, and thank you, Brooks. I in no way, shape, or form am a hero, but I have the privilege of working with heroes every single day, and I'm honored to be working with our team and our healthcare organizations. And I'm so glad to live in Hawaii. When I see some of the things in the news, some of the numbers from the mainland, you're absolutely right. It's great to be here in Hawaii.
Yeah, we've said it for years, for decades, right? Lucky we live Hawaii. Never has that been more true than it has been over the past 14 months or so. Dr. Julius Pham from the Queens Medical Center, thank you so much for being so generous with your time and your knowledge tonight.
Thank you, Brooks.
All right.
Have a great
and
evening.
Everybody, thank you for taking the time for watching as Dr. Julius Pham shares his knowledge with us. He's a big believer in the vaccines. Look, and I know he would agree. If you've got questions, go talk to your physician and get the facts, get the science, and then make the decision that is right for you and your family. Thanks so much, everyone. We will see you again soon, right here on the Weekly Dose. Aloha.